Hi, my name is Cynthia Jester, and I am presenting week 6 SOAP Note, my clinical presentation. My clinical rotation is located in Montgomery, Ohio, and I am doing family practice this rotation. I would like to give you a preview of my case scenario with a gentleman that came in for care. He's an elderly man. He's 65 years old, African American, and he had been complaining of ongoing tiredness and cold intolerance, as well as he's been gaining weight without trying to. I want to get into why this case was meaningful and interesting. This case was memorable because I worked with my preceptor to make the correct diagnosis for this patient, helping him on the road to recovery. Also, hypothyroidism is often either misdiagnosed or overlooked simply because the symptoms are very vague and generalized. I am glad and happy I had the opportunity under the guidance of my preceptor to successfully have a resolution for this clinical scenario. And to determine whether he had the hypothyroidism, I used critical thinking to evaluate the patient's symptoms, his lab, medical history, family history, and looked for a connection between those factors. We did do labs on a patient, and the patient had a TSH and a T4 level that were drawn, and they were pretty conclusive for hypothyroidism. I will move on, and I will do the introduction to the patient. Okay, ID, MR, date of birth 3/15/1960, is a 65-year-old African-American male who presents to the clinic today. He was alone, and he was a good historian. His chief complaint: I'm experiencing fatigue, weight gain, and cold sensitivity. HPI: Mr. Patient MR is a 65-year-old African-American male who presents to the clinic today with complaints of increasing fatigue, weight gain of 15 pounds, cold sensitivity over the last 3 months. He reports feeling cold even when it's warm outside, and and the fatigue and weight gain causes him he's changed his routine. He goes to bed earlier because of the fatigue. He reports that he has tried to alleviate his symptoms by sleeping more and eating healthy, and there has been no improvement in his health. He states the symptoms affects his quality of life, and he denies having any recent illnesses, no change in medication or significant stressors. His past medical history, he is positive for type 2 diabetes. He has hypertension, no surgery, medication, metformin 500 milligrams. He takes that twice a day, Losartan 50 milligrams twice a day. No allergies to food, medicine, or environment. He's up to date on immunization. Family history: his mother is 85 years old. She's living, and she does have a history of hypothyroidism. Social, MR, age 65, African American male. He lives alone, no children, in a 1-bedroom apartment. His occupation: he is a retired customer service rep for one of the insurance companies. His education: he does have a associate's degree in general studies. His diet: he reports that he eats fruits and vegetables. He eats pretty healthy. Exercise: twice a week, denies caffeine, alcohol, tobacco, no drug use, no vaping, sleeps about 8 hours a night, denies any stressors, spiritual support. He reports strong family and community ties, safety, no guns, no exposure to domestic violence, wears a seatbelt when he drives, and his hobby is fishing. His review of systems is only positive for the fatigue and the cold intolerance, and he has the weight gain. His vital signs are stable, they are normal. Although his weight is 178, his height is 5'7", his BMI is elevated, is 28. For this gentleman, we did labs, and we have the results. His THS is 12.8, and his free T4 is 0.6. His blood sugar was 98. He looks generally healthy, but he does look tired. He said no distress. His objectives is only positive that his extremities feel a little cold, his arms feel a little cold, but other than that, everything was negative. No heart palpitations, no problems in the system. I'll move on to the differential diagnosis. I considered hypothyroidism, chronic fatigue syndrome, depression, and my final diagnosis is hypothyroidism. I analyzed the laboratory findings, the patient's symptoms, the patient's medical records, family history, and determined the diagnosis along with my preceptor. The patient has an elevated TSH of 12.8, and he has that T4, that's 0.6, and that is consistent with a diagnosis of primary hypothyroidism. The plan that I have for him is to put him on levothyroxine, 50 milligrams once a day, and he can take that and once every morning, 30 minutes before he has any food. The diagnostic tests that we will continue to do with him, we're going to follow him with the TSH and the T4, and we did do the order. My preceptor, he ordered the TBO antibody testing. Non-pharmaceutical things that he can do, continue to improve his diet, use lotions and creams on his skin, keep his hair washed, moist. We educated him on taking medication before he eats food. We educated him on the diagnosis of hypothyroidism, and which is a lifelong disease. We educated him on some of the symptoms that he needs to be aware of that may be troubling, like palpitation, tremors, anxiety, to report any of these symptoms to the provider. And we did educate him on hypothyroidism as a lifelong disorder, and that he will have to take the medication. We're going to follow up with him in about 6 weeks and continue to monitor him with the labs. We also are referring him for emotional support with a group so that he can identify with others and he can talk with them, as well as getting his family and his friends involved to support him with the exercise and with the with any more diet changes that he is going to get. I also want to talk about the nursing let me see, I used, okay, let me scroll down. Okay, I use the holistic and caring sciences to collaborate with my instructors so that we could get the diagnosis and the treatment for the patient. I use evidence-based practice, clinical practice guidelines that focus on thyroid hormone replacement to alleviate the symptoms of fatigue, weight gain, and any other, psychological impact of not being able to do as many activities as he usually planned. And I develop a relationship with the patient with Gene Watson's Curative Number 4, which focuses on establishing a healing relationship through trust and interpersonal relationships as through the patient's lived experience. The Gene Watson's curative process recognizes that healing requires more than just medical intervention. It also includes emotional support and validation of the patient's perception and a collaborative planning. And that's what I did. I collaborated with my preceptor so that we could get a resolution for this man. I'm referring him for additional support with support groups. And I thank you for listening to my presentation.